My first guest this evening is a spine specialist, Dr. Graysen Petersen Fitz with Bluegrass Orthopedics. Welcome.
Thanks very much, Dr. Fox. Thanks for having me.
When I said millions of people have back pain, and we see a lot of it, you're the specialist in it. Why so much, and what causes it?
Yeah, that's a great question, and one I ask myself, daily in clinic, and I think millions may be an understatement. I think almost everybody at some point in their life is going to have an episode of either low back pain or pain that radiates from their back into their legs or all the way down to their foot even. And it can be caused from anything from wear and tear arthritis, a muscle strain or a muscle pull, or even intraneural problems like a disc herniation or something called lumbar stenosis. A lot of it is age dependent and activity dependent, and at Bluegrass I'm happy to see any of the above.
And when we say back pain, it can be neck all the way down to the legs.
Absolutely, absolutely. When I hear back pain, my focus goes immediately to the lumbar spine, but I'm more than happy to see patients with cervical, thoracic, or lumbar back pain. And for our patients, cervical refers to the neck, thoracic is kind of the rib cage area, the mid-spine, and lumbar is probably the most common I see, which is the low back pain.
So how do we know if back pain is something to worry about? Are there red flags or something to say, hey, this is more than just a little muscle strain?
Absolutely, I think so. The biggest and probably easiest to identify red flag is any change in your day-to-day function, and the easiest way to think about that is if you typically live your life with no pain shooting into your leg or no pain shooting into your arm, and all of a sudden you have that, that's probably time to think about a problem in your spine and maybe seek out a specialist. Other true red flags, really problem things that I see and get called about emergent-wise, are things like changes in your bowel or bladder function, or worse yet, change in your balance when you're up and walking. If folks find that they're really losing their step and falling over more than usual, it's really time to give me a call.
If you have numbness or tingling, does that mean a nerve might be involved?
Numbness and tingling as well, yeah, but to me those are usually more of a chronic sign, something that could have been smoldering in the background for a while, but certainly a reason to get checked out.
Okay. Now, when they end up with you, you're a surgeon, and nobody likes to particularly be operated on, but you do some procedures that can help. Tell me about some of the things that you do to help back pain.
Sure, absolutely, and this applies again to anywhere from the cervical spine down to the lumbar. My first line of defense typically is looking at folks, getting a good physical exam, making sure the nerves are all working in order, and then we can treat a lot of pathology with hands-on modalities like very specific guided types of physical therapy. There are methods called decompressive therapies when we're helping people take tension and pressure off nerves without ever making an incision. And if folks go through that for a period of time and are still having some issues, there's a number of different types of injections of steroid or local nerve blocks, things like lidocaine and marcaine, that can be both therapeutic and diagnostic for a lot of our patients. And we really do try to exhaust all of those treatment modalities before surgery even enters our vocabulary, because the vast majority can be treated shy of surgery.
But there are surgeries. Some people you end up with a bigger surgery.
The range of surgeries that we do as spine surgeons certainly is broad. You mentioned kyphoplasties, and folks who have maybe a bit of osteoporosis and their back isn't supporting them as well as they should, and they have some compression fractures. That's kind of an outpatient procedure. It's very, very quick, gets people back to mobility and get back on their feet a lot more quickly. But it does range all the way to a multiple level spinal fusion from basically as long as it needs to be, and that's a much bigger surgery.
Now, you mentioned compression fracture, so explain to people what that is, because we see a lot of that, especially in our older population with osteoporosis.
Sure. A compression fracture is essentially the bones in the back. You can think of it as sort of bricks and mortar, where the mortar is the disc and the brick is the vertebrae. Typically they look like one rectangle stacked on top of another. If those wedge and they become less rectangular shaped and more shaped like a wedge, and they kind of go from shape like this to shape like this, it compresses down. And when that happens, it's typically because the bone itself is weaker, and it's typically a result of osteoporosis. It can be a high energy injury, but most common thing I'll see is an unfortunate case where somebody has a ground level fall and their back hurts worse than it ever has. That's another good reason to get checked out.
That's great information. We appreciate you coming in. We appreciate what you do.
You bet.
And if you've got back pain, Bluegrass Orthopedics can help. We'll be right back.